All right, ladies and gentlemen, pill poppers and Panadol lovers, welcome to Drug Diaries, the podcast where medicine meets madness and healing gets hilarious. I'm your host, Anyine Jonathan, a pharmacist by profession, storyteller by passion, and an occasional caffeine lover. In today's episode, we are talking about rational use of medicine, how to use your medicine right, and how not to swallow mistakes. There's that song which Taylor Swift sang, and she says, "You look like my next mistake." Please, not your medicines. Your medicines don't have to be your next mistake because medicines need to be swallowed right. Okay, guys, I've been surprised when I'm at the clinic or when I'm at the pharmacy. People want medicines for everything. People who don't get sick often, sometimes they come to the pharmacy and they think they have to bombard their bodies with a lot of medicines, a lot of pills. Some really want injections. Friends, your body is not a war zone for World War III. It is a place that needs to be kept. It's a place that needs to be cared for. It's a place that needs to be treated as gently as possible. So don't start bombarding your body with whatever medicine you come across in whatever amounts possible just because you're feeling pain or a stomach ache or a backache and you think that will get you better. And in this episode, we are going to be talking about how to use your medicines right and the common mistakes that people make with their medicines. At pharmacies and clinics, you'll find out that pharmacies and clinics are not like restaurants where you go to the restaurant, like if you went to CJ's and you tell the waiter to get you the medicine that your neighbor is taking. Or you go to a salon and you tell your barber to trim your hair like Rick Ross. It doesn't work like that in pharmacies. In pharmacies, there is a right drug in right quantities for a certain condition, for a certain patient. And your doctors, your pharmacists always consider each of those things before they give you your medicine. The World Health Organization defines rational use of medicines as when a patient receives medication appropriate to their clinical needs in doses that meet their individual requirements for an adequate period of time. And there are very many ways that people use medicines wrong because probably they don't know, but that is why Drug Diaries is here, so that you do not continue to use your medicines wrong. So kindly share this video, like and subscribe. We're going to tell you a few examples of how people use their medicines wrong. First, self-medication. Some people self-medicate like they're in a competition. It's as if it's a challenge show. There are many things to consider before you take a medicine and before you take treatment. So please reduce the rate at which you're self-medicating, reduce the rate at which you just take drugs, because drugs are crafted and carefully made for a specific purpose. The second mistakes that many people make is treatment without testing. You go to a clinic, they tell you diagnosis is having a diagnosis, so consultation fee is 50,000, or maybe testing is 10,000 or 20,000 Ugandan shillings, and as a Ugandan you're like, these ones just want to cheat us. A lot goes on when it comes to consultation and testing and all that. So I know there are some clinics really which are charging exorbitant prices, but at least have some basic tests. If you have malaria, for example, test. A malaria kit is, I don't know how much, 2,000. If you have ulcers, peptic ulcers, take the test, because when you take that test, that defines whether or not you have that disease, and also that defines which medicine is right for you or which medicine should be given to you. So kindly avoid treatment without testing. The other example of irrational use of medicine or wrong use of medicines that is common is overdose. People who double the dose to feel better, or people who think, if I take this medicine twice, the doctor has told me to take it once, if I take it twice, I'm going to get better sooner. It doesn't work like that. Medicines are meant to be taken over time. There's a quote from a friend of mine that told me that time heals, right? I know many of you know that time heals, but even with medicines, time heals. Time is part of the medicine because your body the medicine needs to get into your body and start acting and getting into your body might take a while. Getting to the receptor or the place where it needs to act might take a while. So pace it down, slow it down. I know you might feel like you're dying. I know it might feel like an emergency. I know you might be having a presentation or a deadline in the next few minutes, but your body needs time to heal. So allow it to do so. The other common one, which we will have very many other episodes about, is antimicrobial. The way you guys use your antibiotics, it's getting out of hand. Some people, the moment they get a cough, they take an antibiotic. You get a sore throat, take an antibiotic. You dream of, you have a bad dream about getting sick, you take antibiotic apparently for prophylaxis. Please make sure that you get your antibiotics from the right doctors, and make sure that you complete your doses if you're taking antibiotics. Another form of irrational use of medicines is people say that injections don't work for them. For them, they prefer tablets, or people say that the weaker medicines don't work for them. They prefer the very strong medicines. Lastly, but not least, there are many more, but these are the quickest that I can think of, is non-adherence, or the people who don't want to finish their doses. And I've talked about this with antibiotics. Please, this is more strict for antibiotics. Please, if you are taking an antibiotic for an infection, take it in time, finish your dose. I believe this is very important because there was a recent space on X where we're talking about why there's a big rise of ulcers, or peptic ulcers as you might call it. And one of the reasons is people don't want to finish their medication for ulcers. The moment you don't finish your medication for ulcers, the H. pylori, the bacteria that causes ulcers, is going to become resistant to whatever medication you've been taking. And before you know it, you start going to other levels of, antibiotics, more expensive brands. And before you know it, you probably can't afford, or you're not even finishing the expensive brands, and that becomes disastrous. And of course, as we know, peptic ulcers leads to stomach cancers, cancers of the GI, and all that. So kindly finish your medicines. Adhere to the medicine, adhere to the dosing, adhere to the frequency of dosing, and make sure that you take your medicines right. And as you conclude, please seek help from your doctors about your medicines, not your TikTok influencers, not Mr. Google Sir, not your Twitter influencers. Seek help from the doctors, have conversations with your doctors, and get to know what your medicines are. Please don't take medicines with alcohol. It's not advisable. That is why pharmacies do not necessarily have alcohol dispensers. If it was advisable, maybe some pharmacies would serve alcohol with medicines, since some of you really love alcohol a lot. Also, store your medicines properly. When medicines are exposed to certain conditions like heat, they might degrade, they might break down, they can lose their efficacy or their ability to function. So kindly store your medicines well. Avoid sharing medicines. That will also help you to finish your doses. If you have a girlfriend and you think you can share that, please, it doesn't work like that. This also goes, of course, big to people living in extended families. You take a medicine for 2 days, and you feel better, and you're like, let me keep this one for my uncle. They are also feeling like this. Let them get their own medicine. Thank you so much for tuning in. It's Drug Diaries. I'm your host once again, Anyine Jonathan. Please subscribe, tell your friends about this information. Till next time, catch you next time. Thank you so much.